For nearly a century, this building was part of New York's public health system. It treated thousands, it employed an entire community, and then, quietly, it was shut down. This is Rolling Hills Asylum, and this is why it closed. Part 1. The Mandate. To understand why this facility failed, we first have to understand why it was necessary. In 1826, there was no Social Security, there was no Medicare, there was no safety net. If you were an orphan, a widow, or disabled in rural New York, your survival depended entirely on the charity of your neighbors. That system was failing. So the state issued a mandate. Each county was required to build a poorhouse. On January 1, 1827, Genesee County opened this facility. It wasn't designed to be a prison, and it wasn't originally an asylum. It was a solution to a desperate economic problem, a centralized place to house the vulnerable when society had nowhere else to put them. Part 2. A Village of Necessity. For the next 100 years, Rolling Hills operated less like a hospital and more like a self-contained village. The philosophy of the 19th century was simple. The institution should pay for itself. This was a working farm of 200 acres. The residents, then called inmates, were expected to work if they were physically able. They raised livestock, they canned vegetables, they baked their own bread, and they built their own furniture. The cost to the county was calculated down to the penny, approximately $1.08 per resident. It was a diverse, often chaotic population. You had Civil War veterans living alongside the elderly. You had people like Roy Krause, a banker's son with a medical condition causing giantism who was dropped off at age 12 and lived here for 50 years. It was a catch-all system functioning on routine, labor, and extreme frugality. Part 3. The cracks in the system. But by the turn of the 20th century, the model began to strain. The first major crack appeared in 1887. The county realized it simply didn't have the medical expertise to handle severe mental illness. A policy shift transferred the acutely insane to state-run hospitals, leaving Rolling Hills with the chronic cases, the elderly and the infirm who had nowhere else to go. The facility was aging, the infrastructure was crumbling, and in 1956, the reality of that decay turned tragic. A fire broke out in the men's dormitory. 15 residents lost their lives. It was a stark, brutal reminder that a 19th century farm complex was ill-equipped to serve as a modern medical facility. Part 4. Obsolescence. The decision to finally close Rolling Hills wasn't made in a single meeting. It was the result of a changing world. By the 1960s, the United States was undergoing a massive shift in how it treated the poor and the mentally ill. New medications meant patients didn't need to be locked away. New laws, like the Community Mental Health Act, argued that care should happen in neighborhoods, not in isolated institutions on the edge of town. In 1964, the county tried to adapt. They rebranded the facility as the Genesee County Nursing Home, but it was a cosmetic fix for a structural problem. The buildings were too old, the heating systems were inefficient, and the poor farm model of welfare was legally and morally extinct. Part 5. The Silence. The end came with bureaucratic precision. As the 1970s approached, the population dwindled. Wings were closed off, the farm operations were scaled back. The county prepared a new, modern facility in the nearby city of Batavia. On January 1, 1974, exactly 147 years to the day it opened, Rolling Hills ceased operations as a county facility. There were no riots, there was no great fanfare. The buses simply came, the remaining residents were transferred, and the doors were locked. Part 6. What remains? Today, the physical shell of the institution remains, but the context is often lost. We see peeling paint and empty corridors, but we often miss the human scale of the history. Over its operation, more than 1,700 people died here. many buried in the on-site cemetery with markers that have long since eroded. It stands now not just as a ruin, but as a monument to a specific time in American history, a time when the solution to poverty and illness was isolation. Conclusion. When we look at Rolling Hills today, it is easy to see it through the lens of a ghost story. But the real story is about public policy. It opened because a community needed to solve the problem of poverty. It closed because we decided as a society that we could do better than the poorhouse. It is a reminder of how we once treated our most vulnerable and a challenge to ask how well we are treating them today. Stories like this are part of a larger system history. If you'd like to explore more, you're welcome to stay.